Hey guys, good morning. How's it going? Let's quickly discuss a little bit about white coat hypertension. I also want to discuss a little bit about what stress can do to your body. Have you heard of white coat hypertension? That is when you go to a doctor's office and then you start thinking about, oh, they're checking my blood pressure. I hope it is going to be okay. So you start thinking about it, and then just the thinking process just makes your blood pressure goes up. For some people, they are not even thinking about it, but internally, subconsciously, they're just aware that their blood pressure is being taken, and then it just raises the blood pressure. That's kind of a little bit of a stress. Stress can do all kinds of stuff. Have you guys heard of stress hyperglycemia, where your sugar goes up because of stress? So these are all patients who are not diabetics. You check their hemoglobin A1C and it's well within normal limits. But let's say that they had a car accident, and now they got multiple fractures and they get admitted to ICU. And then in the ICU, when you start checking their blood sugar values, it's all running in the 200s. And then the question is, okay, now do they suddenly have diabetes in the ICU just because they are admitted? No, it's not diabetes, it is just stress hyperglycemia, because they're so stressed out internally. In fact, the patient might be completely unconscious. They may be in coma and all that because of the accident, but the body is just going through such severe stress, so the sugar is running high. So in the intensive care unit, what we do is we just treat them with insulin and all that, and then when they get discharged, they follow up with their primary care doctor. In fact, they may even get discharged with insulin injection or some medications, but when you follow them up in the next few months, slowly their sugar would just get better, and then they may be taken off of all their medications. So that's what stress can do to you. And similarly, there's something called stress ulcers, in the stomach. You're admitted to the hospital, and then you start having some bleeding, and when you go inside, do an endoscopy, and then you find that there are ulcers now, and that is stress ulcer. So stress can do a lot of damage. And then a subtle form of stress related high blood pressure is white coat hypertension. So a lot of patients, what they do is, especially people who are very knowledgeable, who read a lot and who don't want to be on pills. So these are the patients who fall for the fallacy of that logic. Oh, I have white coat hypertension, so I don't really have a real hypertension. Whenever I go to the doctor, and when they check it, my blood pressure is always a little bit high, but I check it a little later, it's normal and all that. And so they use their own logics, and then they kind of don't take any of the pill. So the doctor gives them a pill, they just say like, no, I don't want to take a pill. And then what happens is the affected person is the patient themselves. You see what I mean? And some of them end up actually losing their life, because they might have had real hypertension and they call it a white coat hypertension, and they had real cholesterol problem and they didn't take a cholesterol pill, and then 10 years later, now boom, they have a heart attack. So guys, a lot of patients who think you just have white coat hypertension and you are trying to not take the pill, just bite the bullet and take it. Be careful about these things, okay? Because it's easy to call something as white coat hypertension and ignore it, but you may really have a real problem. And many of the time, these hypertension, when it first shows up in your life, it is kind of the tip of the iceberg, and you need to, catch it at the earliest so that you don't allow it to really big damage like the Titanic ship. Talk to you later in my next post. Goodbye.